Hi, so my name is Maddie. I'm going to be your nurse practitioner student today. Is it okay if I do an exam on you?
Mm-hmm.
Great. So we're just going to start, we're going to go head to toe, okay? So first thing I'm going to do is just inspect your head, looking for symmetry, any signs of trauma, looking at your scalp. Everything looks good. I'm going to assess your cranial nerves, so I'm going to have you do a few things for me. Can you raise your eyebrows up? Good. And can you close your eyes really tightly? Great. And then can you puff your cheeks out? Great. And then do a smile, show me your teeth? Great. And then make a frowny face? Great. Okay. Next thing I'm gonna do is I'm just gonna feel your temporal pulse. Looks good. And then I'm just gonna feel your jaw here. Can you clench your teeth for me? Great. And then open your mouth a couple times. Great. Okay. Next thing I'm gonna do is I'm just gonna see if you can feel light touch. So I'd just like you to close your eyes and tell me when you feel this, okay? No, no, no. Great. Okay. Next thing I'm gonna do is just assess your eyes. So just looking at your eyes, looking at your eyelashes, everything looks good. I'm just gonna have you follow my finger with just your eyes, okay? Okay. And all the way in. Great job. Okay, next thing I'm gonna do is I'm gonna dim the lights. And I just want you to look at a point on the back wall. I'm just gonna shine a light briefly in your eye a couple times, okay? So just look behind me. Great, just looking at your pupils here. Sorry, that's okay. All right, great. Next thing I'm gonna do is I'm going to look at the internal structures of your eyes. So I'm gonna put the light in there for a little bit longer this time, okay?
Okay.
Okay, just keep looking at the back wall. I'm looking for the red light reflex. And then looking medially and laterally to the disc. Okay. Same thing on this side, okay? Alright. Looking for the red light reflex. And then looking medially and looking laterally. Great job. Okay, next thing we're gonna do is assess your ears. Looking at your ears and looking for any symmetry. Everything looks healthy, no signs of infection. We're just gonna do a brief hearing test. So I'm just gonna whisper 3 words to you and I just want you to repeat them back to me, okay? I'm gonna kind of plug your other ear, okay?
Red, blue, yellow.
Same thing on this side.
Cat, dog, mouse.
Great. Next, I'm gonna look at the internal structures of your ear, okay?
Mm-hmm.
Okay. So I'm just gonna pull in your ear a little bit, pulling up and back. Looking at your tympanic membrane. It's curly and healthy. Same thing on this side. Looking at your tympanic membrane. Looks good. Okay. Next thing I'm gonna assess is your nose. So first thing I want to do is just I'm gonna plug each side of your nose and just have you sniff in. Okay. Great. Next, I'm going to look at the internal structures of your nose. So I'll just have you tilt your head back for me. And I'm sorry this tickles a little bit. Good. Looking at the turbinates. Same on this side. Everything looks pink and healthy. Great. Next thing I'm gonna do is just look at your mouth. So I'm just gonna have you open your mouth. Great. Just checking your teeth. Looking at your cheeks. Could you lift your tongue up for me? Great. And then I just have you open your mouth wide, say ah. Great. Looking at the hard and soft palate, and I'm gonna do a quick gag reflex. Great, sorry. Everything looks great. Next thing I'm gonna do is just feel for your lymph nodes, okay? So looking at your neck, everything looks symmetrical. I don't see any signs of tracheal deviation or anything. I'm just gonna feel your lymph nodes now. Don't feel anything hard or firm. So the next thing we're gonna do is just assess your thyroid, okay? So I'm gonna give you your water here, and I'm gonna have you turn a little bit. I'm gonna feel on your neck. I'm gonna have you take a sip and just hold it in your mouth, don't swallow, okay? Feeling for your neck. Great. Okay, now tilt your head towards me and down, and now swallow. Great. One more time the other way, and swallow. Great. Okay.
Thank you.
Okay, so next thing we're gonna do is I'm gonna assess your chest and your breathing. Okay, so could you just pull your gown down for me? Good. Just looking at the chest, everything looks symmetrical. Looking at your AP diameter, looks good, 2 to 1. Next thing I'm gonna do is just percuss on your chest, okay? So I'm just gonna move my hand around on both sides, front and back.
Sounds good.
Great, and then I'll do the same thing on your back. Great. And then I'm gonna listen to your breathing. So every time I move the stethoscope, I just want you to take a breath in and out. Okay. Okay? Okay. Great. We're going to do the same thing on your back. Next thing we're going to be assessing is your heart. So I'm going to feel for your carotid pulses. I'm just going to do one at a time. Okay. Great. And then I'm going to actually listen to it as well with my stethoscope. Okay. And now I'm just gonna listen to your heart sounds, okay? You can breathe normally for this part. Okay. and do it one more time. Great, that's it.